احنا عندنا بلان ان شاء الله على سبيل
ممتاز ممتاز. اذا تبون اي مساعده احنا طبعا
احنا متفقين نقعد عندكم نسولف
ان شاء الله.
يكون هذا
ان شاء الله. لان عندنا احنا كل يعني
check check check
الله يسلمك الله يسلمك.
separate channel. This
Yeah,
one left and
that's-
right.
I will just switch.
Oh yeah.
I think must intro will only external.
The thing is, these are mono channels. This is not stereo. So I have only.
You get only mono.
Yeah. So which one you gonna have? External.
No, no, both are. Switch. Both. Internal mic, and after the lecture start, I put external.
بسم الله الرحمن الرحيم. السلام عليكم ورحمة الله وبركاته. Good morning, everybody. It's very exciting for us today to have our opening day for the 2019, and this is the first of other activities to come, inshallah, during this year. Our Health Awareness Day today, inshallah, is going to be including a lot of good activities. One of the activities I think that you've seen already, that's the basic health checkup, the blood pressure, the blood sugar, which is available for everybody in addition to the weight. And it's a good idea that every now and then we do check those parameters to know that everything is in check and everything is all right. The other thing is having our strategic partner, the Kuwait German Lab, which I would really thank them very much for being present with us today here to provide their services. So they will be providing the usual blood sampling for the vitamin D in addition to the PSA, that's for the males, in addition to the other services which are optional as your request. If anybody requests any additional tests, he can discuss it with the Kuwait German Lab. Also, we'll be having, inshallah, 2 lectures today. We'll be starting with the breast cancer awareness lecture with Dr. Majid Al-Ghatan, whom I should also thank very much for being with us today. I know she's a very busy lady in the Ministry of Health. Anybody who works in the Ministry of Health is busy always, actually. So giving us those few minutes here is really, I think, to be thankful for. So thank you for being with us, Dr. Majid. Then after that, inshallah, by I think 12:30, we'll be having another lecture by Dr. Ahmed Al-Nizi. It's going to be about prostate cancer. The topic is male mostly. However, when we talk about cancer, nowadays we cannot see maybe a house in Kuwait without a case of cancer, either a male or female. So it's always wise to be to have awareness about those diseases and to know how to know what are the symptoms, the signs, and how to handle such cases. So inshallah, it's going to be exciting day. Inshallah, we'll try to be at your service during all those hours from 9 till inshallah 2 p.m. So let's first also start with our usual safety moment, which is going to be presented by my colleague, Nurse Heidi. She's going to talk about the hand washing. So please come. Sorry, Heidi. Before that, I think we should give also a minute or two for Butala Mohammed Al-Shamari, our leader, to talk about the thing, and we take the hand washing after that.
Thank you, Doctor, very much for this introduction. Also from Kuwait Higher Management and all Kuwait employees, please give a warm welcome to Dr. Majid Al-Ghatan for being here. Again, I second Dr. Sajid that she's very busy and sparing some of her valuable time to share with us some knowledge, awareness about breast cancer. This is very kind of you. And we just talked with her 5 minutes before the lecture that this will not be the end of our cooperation with the Ministry of Health in general, or Dr. Majid, inshallah, in specific. So this is going to be continued. The awareness of the cancer in general is needed. I'm sure that everybody, unfortunately, is having a private, experience with somebody he knows that had breast cancer or any kind of cancer. So the way to fight this cancer is actually to know more about it. This is usually what they say. If you are afraid of something, knows more about it so that you know how to fight it. So this is one of the things that with Dr. Majida we need to do. And something, inshallah, what we know that the early examination is very essential to fight, to discover this disease. And inshallah, with how God willingness, everything inshallah will be solved. Nothing more than this, except again we thank German Lab also to be here with us, and the willingness of the employees in the company. This is something is needed because this will enhance the working environment. This will reduce the stress of the people, and the morale of the people is going to be increased, and productivity will be increased. So this is something Dr. Saad is working on with the wellness team, Dr. Ramesh personally is supporting this, and hopefully within the next days, month, you're going to see something, inshallah, will help all the people here to, inshallah, be more wellness and more happy. Then if you go to the Dubai Emirates, what you will see? مكتب بالضبط مكتب سعادة المواطن. Okay, and you will see surveys everywhere that if you are happy or not happy. Okay, why? Because the happiness of the citizen, or in our case, the employees, is very vital for us. So again, welcome Dr. Majida for this. I will not take more than 2 minutes for that. And I wish you a very happy day. And today is Valentine's Day. Thank you.
Thank you. So now we'll be set a moment with Nurse Heidi.
Good morning, ladies and gentlemen. As part of our safety moment talk today, we are going to discuss about hand washing, which is a corporate activity. Hand washing is an inexpensive and the most effective way to prevent the spread of germs and keep employees healthy. Hand washing gives people the opportunity to take an active role in their own health. Most hand washing studies have focused on child care or healthcare settings. The few that have looked at corporate settings show that promoting clean hands results in fewer employee sick days. One of the benefits of hand washing is improving health. Germs can spread quickly. A healthier community means a healthier employees. Hand washing education in the community reduces the number of people who get sick with diarrhea by 31%. It reduces diarrheal illness in people with weakened immune systems by 58%. It reduces respiratory illnesses like colds in the general population by 21%. The second benefit of hand washing is saving time and money. Hand washing is one of the best ways to avoid getting sick and spreading illness to others. As they say, sick employees are less productive even when they come to work. They may also spread illness to others at work. One recent study promoting clean hands in a corporate environment showed that fewer employee illnesses, there is less use of sick days. The third one is helping families and workforce thrive. Employees with healthy children, as they said, spend less time away from working time, from work, taking care of their sick children. They are more productive at work when not dealing with family illnesses and get sick leave less often themselves. Employers should promote employee hand washing and encourage them also to teach their children good hand washing technique, remind children to wash their hands, and wash hands with their children. Despite the widespread knowledge of the importance of hand washing, there is still room for improvement. And they said that a recent study showed that only 31% of men and 65% of women wash their hands after using a public restroom. Okay, to add something to this, I will just try to show each one of you how to do a simple hand washing technique in order for us to learn that we can do it as a habit whenever we go to the toilet, when we are at home or especially at the office. Okay, we lather our hands with water. The soap is there. Then we have to spread it in our hands. Okay, the first thing to do is to put the top of your palm on the other palm, the top of the palm, rub it. After that, you have to palm to palm. Okay? After palm to palm, the fingers. Rub it, After that, the thumbs. Rotational. Rotational. And after that, these 4 fingers. Rub it or slowly rotate it. Slowly rotate it. Then wash. Wash your hands. Water. If you're in the toilet and we are here, you can rest the tissue, dry, again, another one, dry. The third one, if you are in the toilet and that one is not automatic, the faucet is not automatic, place the tissue, close it, then throw it in the bin. And when you're going out in the toilet, the door, grasp again another tissue, and that's the one you will hold with the door. Okay. So you don't spread any germs. You avoid spreading this one. Yes. Counting. It should last for 20 seconds. You can sing happy birthday while you're using it.
Thank you, Heidi, for that interesting presentation. The last part wasn't part of the scenario. It was to my surprise, so we had to come up with the idea of me holding the microphone forever. Anyway, thank you very much for that. Actually, the hand washing is a thing that we tend to forget, actually. We do it whenever we go to the toilet, however, I think we should do it more than that. Now contamination is everywhere. Things that we deal with daily, even let's say not daily, every minute we are dealing with things that are more contaminated than a toilet seat. I think you've seen that message coming through the WhatsApp and the social media saying that the mobile phone screen is more, like 20 times more contaminated than a toilet seat. So if you have to wash your hand after using the toilet, I believe you should be washing your hand many, many times after using those mobile phones. In addition to always making sure to clean those screens of the mobile phones, not just yours, especially the iPads for our kids. The iPad of the kids is a hell of germs, actually. Eating chocolates, eating everything while using that device makes it very contaminated. Thank you, Heidi, once more for that presentation. Now we'll be starting our main lecture for today, one of the 2 main lectures for today, the breast cancer. One note, actually, we'll be distributing those pads, John, please. So whenever there's like a question or something that you do not like to say in public, you can just write it, and after the lecture, Dr. Magda will be dealing with all those questions. After the lecture, there will be a session for questions, for verbal questions, in addition to the written ones. So please, Dr. Magda, come forward for the lecture. Can I hear a round of applause, please?
Bismillah ar-Rahman ar-Rahim. Good morning, everyone. Today, first, I'm Dr. Majda Al-Gattan, Consultant Family Physician and Assistant Undersecretary for Public Health in Ministry of Health, Kuwait. Actually, when we talk about awareness, nowadays you find all over the world people are talking or return to talk about awareness because health economy or health budgets are highly inflated because of the technology that they are using regarding the diagnostic or management part of diseases, most of the diseases. And it's very costly. And mostly, maybe you always find that military and health taking the big part of budgets in all countries. So when we talk about awareness, one of the things that we are talking about is breast cancer. Why we are talking about breast cancer? Because as soon as you discover any tumor in a breast in early stage, that means it's localized and it's small in size, so you gonna have actually totally or complete cureness from this tumor. Sometimes even by day procedure, simple procedure, opening the skin and taking this lump out, since it's localized only in the breast, and that's it. You will not need any additive like treatment, like chemotherapy or radiotherapy or any other hormonal therapy. So early detection is very helpful, and also this will save your life. And when we talk about breast cancer, why breast cancer? Because the breast cancer is a very common disease in women. Every 9 women, they will have every 8 women, they will have 1 female will get breast cancer. Actually, when we talk about the tumors, 90% of the tumors are benign, okay? But the early detection will help us, okay, if it's cancerous or malignant. Actually, when we talk about, when we talk about tumors, we will talk about the breast. A breast usually, it's a fat with connective tissue, and there is a milk duct, and lymphatic and blood cells, or a blood tissue, okay, and vessels. Actually, tumor can happen in any part of the composition of the breast, as I mentioned to you. It could be from the connective tissue disease, it could be from the blood vessels, it could be from the milk duct, so it can be from any part of this breast composition. What is cancer? Cancer is a multiplication of any cell in the body out of the control or out of what usual happen in this division or multiplication of this cell. And why this is happening? So it's out of control. It could be because of something we cannot work with it, like genetic and these things, okay? And it can be because of some risk factors that we can work with it, and we can prevent us or decrease the percentage of having this breast cancer, like obesity or physical activity, okay? And I will talk about this in details. So there is, regarding this multiplication, if it will be genetic, so we cannot do anything about it, okay? Although these years somebody is telling about breastectomy, that taking the breast before even having the tumor as a protection. But I don't think too many ladies will like this idea. So what's the risk factor? Actually, we cannot say that there is a significant or direct cause of this breast cancer, but we can find that a lot of risk factors. What do we mean by risk factor? Risk factor that if you have these kind of things, you will have more chance to have a breast cancer than other people. When I said about gender, like being a female will get you a higher chance of having a breast cancer. Aging, as you get elderly, you will have more chance to get breast cancer. And this is also with most kind of the cancer types also, not only for breast cancer. Genetic risk factor, as I mentioned. Family history, if you have first degree relative, your mom, your sisters, if they have a breast cancer, and especially those type of genetic background, then you will have more chance of getting breast cancer than other females. Personal history, having a previous breast cancer in one of the breasts will give you more chance of having another breast cancer in the other breast, okay? Previous chest radiation, excessive radiation, okay? Post-menopausal or hormonal therapy. If you have, you know, even nowadays, maybe there is a lot of debate regarding the menopausal hormonal therapy. In the past, everyone getting, all ladies becoming in the age of perimenopausal, they start to take this hormonal therapy to protect themselves, like from aging and these things and hormonal disturbance. But nowadays, they find that there is a relation in having cancer with these hormonal or contraceptive that pills that having a lot of progesterone. Dense breast tissue, this is only found in X-ray. When they do mammogram, these people will have more chance, and not having children or not having them later in life, like, you know, early pregnancies protect from breast cancer, breastfeeding also protective from breast cancer. The time of the period, like if you have your first period early and your last period very late in your age, you will have more chance of having or more risk to have breast cancer than other people. Also, less activity and overweight, and we always talk about these two factors because we can work on these things. We can do physical activity and we can lose weight, so to protect ourselves from not only breast cancer, most of the cancers like colonic cancer and other cancer, they found a big relation between obesity and less activity or physical activity with kind of cancer. What do we mean by breast cancer screening? Actually, the simple thing, or the not only simple, it's costless, okay, and can be taught very simply, okay, is a breast self-examination. And you remember, Dr. Sajid, this was a big campaign that we work with it, with Equate, actually maybe 10 years, 10? No, I think more even more. خلي عمرك وردي, and it was a big campaign, and I think we were 6 physicians, family physicians, we share these sessions. Actually, I still work in breast cancer because I think this is my baby, actually, because I was the first physician that start a breast self-examination clinic in all over Kuwait. And I got like the title of Woman of Science, okay, because of this project from the state, okay. So actually I like this project very much, and even when Dr. Sajid told me that we need somebody to talk in this area, I still like to talk in this area. Breast self-examination is very simple, very easy. Anyone can be do it without any cost, okay? And actually, I like always to talk about it because when we say that we have to choose the proper time, and it must be every month, and how we can do it. Actually, when we talk about the proper time, usually it's 3 to 5 days after any lady had her period, if her period is regular, okay? If her period is not regular, then she has to choose fixed day every month. Why we want it to be fixed day? Because if you have the same day, then you will notice any change, okay? So this is number one, or rule number one in doing a breast self-examination. Either you choose the fixed day if your period is not regular, or if you get menopausal, so you will not have any more your period, and you did do it third or fifth day after you finish your period, if it's regular, to notice the changes. Okay, how we can do it? Actually, usually I say that we will use these 3 fingers, and we will use the last part of the fingers. Why? Because this is very sensitive. Okay, and we have here a model. Okay, so actually I will do it like this is the breast. Okay, can somebody help me in holding the microphone, please? Yes. Suppose that this is the breast. Okay, usually the breast is a skin, and under it is a fat tissue. Okay, breasts are different in size. Some ladies have big size of a breast. Okay, and some ladies have small. Usually small is much easy, but actually because somebody have, or some ladies have big size of breast, so that's why usually we divide the breast, okay, as 4 quarters. And the tail of the breast that's in the axilla, this is part of the breast. So when you want to examine your breast, don't forget to examine your axilla, because the tail of the breast is usually is in the axilla. We'll start by these 3 fingers, okay, and we will use around circular, okay, rotation, and we will divide the breast as 4 quarters and then the axilla. So as we moving these 3 fingers, we will use it as if we are massaging the breast, okay? And when you finish from 1 quarter, you will go to the other quarter, and then you will complete the 4 quarters, okay? Then you will go to the axilla to see if there is any also mass. Some of the masses, because this is also part of the breast tissue, may be found in the axilla rather than in the breast itself, okay? So by this all movement, you will be finish your examination. But not this only. First, before you do this movement, you have to see. And usually, even for us, as we are doctors, thank you very much, usually we say before you examine even the patient, you have to see him, to look, okay? And usually there is a lot of signs you may be noticed, and these signs indicate that there is underlying breast cancer, okay? So first, you will see the size of the 2 breasts, and usually I said either you put your hand on your hips, okay, and you press on your hip, or you put them on the back of your head, okay, and you press. That's because you will see the size of the breast, and you will notice if there is any difference between the 2 breast sizes. The other thing, by this movement, you will see the nipple, okay, if the nipple is inverted, okay, or it's usually inverted but becoming more inversion, or usually it's flat but it's become inverted, so this is one change. Maybe there is underlying tumor pulling it, okay, from the skin, and you will see if you will find any changes in the skin. There is bruises, there is itching, okay, or any redness, and usually advanced sign of breast cancer is blood orange, and this is skin of the orange, and this is a French word, blood orange. That's, you will find that the skin of the breast will be very hard, and there will be like spots, okay, as if you are seeing the skin of the orange, okay? Very hard. So these things, or sometimes you will feel that your breast vessels are, you can see them, okay, dilated, so you can see them. So all these signs you can see before you start your examination. So by this, we will do the breast self-examination, and as soon as you find any difference, you can consult your doctor, your family physician, and you can talk with him about these changes. And then the next step, that the doctor will do the clinical examination. So breast self-examination is the first thing that you will do it yourself. The next thing is a clinical examination done by the physician. Then there is other investigations, and usually in the past they started by age 45, especially for high-risk people. They will do it every year, and if there is no risk factor, they will do it every 2 to 3 years, especially if the first one is normal. It's for mammogram, okay? And in difficult cases, or if they find any suspicion, they will do MRI. But these days, they make the age less, and they will start by the age of 40, because they find that breast cancer start earlier. Okay, so they don't want to miss these numbers or this age. And as I mentioned for you, the breast self-examination, and this is for the mammogram. And mammogram, usually you know that there is two plates, and the breast will be in between. It's painful, but at time of the examination. Otherwise, when they take the blades, no pain, supposed to be. So how all women can lower the risk? Can you think about something that will lower the risk? Awareness, okay. But awareness will have early detection. But what about the risk? Exercise, physical activity, yes. What else? Lifestyle. This is with the physical activity. What? No, this is related to obesity. So food habit and lifestyle, and this is physical activity, and what other thing? Breastfeeding. Breastfeeding. They found that regular breastfeeder ladies, they are much less in having the breast cancer. Early pregnancy. In life, early pregnancy, not using contraception, okay, not taking hormonal therapy. So these all will lower the risk. So, okay, so weight reduction, be active. And this is all about today's lecture. And if you have any question, I'm ready to answer. And thank you very much for your listening to me. Thank you.
Is there any written questions?
Any written question or a question like this, if you want to ask? If there is no question, that means my lecture was perfect. Yeah. Thank you. Thank you. Okay. Okay. Thank you very much. شكرا دكتور.
We'd like to thank Dr. Magda for this interesting lecture. Be careful, actually, you want to be harmful. It's always wise to know more and more about these illnesses and diseases, and to be able to transfer the knowledge to other people. It's not necessarily just for yourself, but also to transfer the knowledge and correct many of the misinformation that we are receiving daily from the media, actually. To know the proper knowledge is the right way of handling it. Thank you very much, Dr. Magda, for that. We have just a small token of appreciation for you, so please come forward. Mr. Mohammed Shamri will be giving that.
It's okay with this. It's okay. It's good.
Just little
Forward. Okay. You can put.
I think you want this to be done. Yeah.
So thank you very much for being with us in this lecture. We'll go back now to our usual services over there. The other lecture will be inshallah by 12 afternoon. So anybody interested, please most welcome. Thank you very much. Thank you.
I think I have to ask the recording because I missed the beginning. The intro is only intro. Stop. Live?
It's on now.
Yeah. And only next speaker will start.
Better, huh? Yeah, okay. Just put the logo.
Which logo?
The EGLM. The